Hi. Um, if you are new to my channel, I am a CNA in a hospital. I'm working overnight now, and not gonna. There we go. I'm overnight now. Um, what my position currently entails is doing screening for coronavirus. Um, I am about 18 weeks pregnant, and I screen for coronavirus nightly at my job. I am the first person throughout the night that anyone who's coming into the hospital sees. They usually see me, this isn't the correct mask, by the way, but they usually see me in a mask, my eyes, I usually have on my gloves, um, and I sanitize before um, coming in contact with anybody that comes to the door. I ask them several questions, um, and because I am in a closed area, I have to talk to them through the phone on the wall, which I also clean. And they have a phone outside. Um, I just instruct them to pick up the phone, and we converse that way. Um, I give them a wristband after they have passed my questions. If they are displaying any visible symptoms from what I can see, I put a mask on them, get them to sanitize their hands, and I call security and have them escorted to the emergency department. Now, we have two ways to get inside of our emergency department. Um, if you are displaying symptoms, I escort you by help of the nurse supervisor or security out the back way, which is out the door and down um, pretty much the ambulance entrance. If you are not displaying any of those symptoms and you are having something, I don't want to say minor, but something that can be taken care of otherwise, migraine or accident or like you fall in or cut yourself or something like that, I can escort you through the front way. So I sit here from about 11 p. until 7 a. Someone relieves me for break, and I get relief for the morning. But I sit here typically with my snacks, my music, um, and I figured a lot of people are talking about the coronavirus, but we're not seeing people who are actually coming in contact with coronavirus. We're not seeing people who are in healthcare um, confronting pretty much coronavirus. Um, so I figured I'd just get on and talk a bit about that. So I have a lot of papers on my desk. Um, these are the bands that we put on people. These are like we have them color coded per day. Um, but I go through my PPE for COVID-19 coronavirus. I have a list of situation, patient PPE, the room type setup that they would be on, and healthcare worker PPE that is required for such care. Um, we have also restricted the amount of visitors that we have trafficking the facility. Um, we have special situations, possibly hospice or emergency, that we would allow only one visitor. Hospice, of course, will have more due to the severity of the patients up there with passing and such, and family wanting to be there for their loved ones. But for the most part, we do not have or allow any visitors in the hospital. We have a little waiting area um, out front, um, and that's pretty much it. So as I mentioned before, I'm usually in mask with gloves and sanitizing. Um, I am the only one out here. There's no one out here with me. Um, yeah, I'm just here. Excuse my hair. Looks a mess, but that's okay. Um, so the questions that I typically ask are, um, and what I look for. I don't just ask them, but I actually look for um, signs of having a fever or respiratory distress or I'll do something like ask them to take a deep breath for me and hold it for the count of 5 seconds. Um, just different things to see if they are having any sort of respiratory issues. Um, I don't know. It's really not too bad. I've had a lot of people ask me if I am fearful or scared of the coronavirus. And I've been in healthcare for a little over 10 years. Um, the coronavirus, just like the swine flu and um, H1N1 and all of those other things that have come before it, don't scare me. The only thing that honestly scares me is getting a needle stick from patient contaminant. That's about it. That's the only thing that scares me. That's it. Um, so since I've explained what I'm doing at work currently, I will talk a little bit about my pregnancy. As I mentioned before, I am 18 weeks. Um, our doctor's appointment that was supposed to be coming up this coming up week was canceled due to the coronavirus. Um, but it has been rescheduled, so I can't really say it's been canceled. It's been rescheduled to a later date, which is the same day that we find out the sex of our baby. Um, Team Boy, comment below what you're thinking that we will have. We already have 4 girls. And just for reference, I have not wanted anything sweet. I've been craving salty and crunchy. Um, so this is the first pregnancy I've only wanted salty, crunchy foods. Eating a lot of Mexican too. Um, but yeah, so we find out the sex of our baby in April. Um, hoping for a boy. The kids are all out of school till after spring break, so that's fun. I'm one of those parents that actually enjoy my kids being at home. Um, I can talk a little bit about that as well. So, when I get off of work, I typically am home um, by about 7:30, 7:45. And my kids are usually up at that time. So I typically fix breakfast if they haven't already eaten before I got home. And I'm not a teacher by any means, but I will look up educational programming for my kids to watch. I'll ask them questions regarding said information. I keep checking the door. It's back there. Um, but I ask them questions in regards to what they've seen. I give them paper and pencil. We go over cursive writing. We're learning sign language, which my babies in school are not learning. And because of all of this, my 2-year-old is actually speaking quite well to be 2. She comes to me and, Mommy, I like your hair. I like your hair. It's beautiful. It's beautiful. Even though it looks a hot mess. Kids are awesome. I fix them lunch. And after lunch, they read for about 30 minutes to an hour. I ask them questions in regards to what they've read. And then they take naps. And yeah, I usually have to work that following night or later on that night. So I usually get naps throughout the day. So when I fix them breakfast and I get them situated with their educational television, I take a nap. And it's screened from my phone, so I know exactly what they're watching. and how long everything takes to be viewed. Um, so I set my alarm to after that. And then I wake up, I get lunch situated, and then they'll either watch more educational programming, or they'll work on writing or English or math. Um, and from there, I'm sorry, I'm kind of dragging out my words. I'm thinking as I talk. Um, from there, while they're doing that, I'll take another nap. I've usually gotten dinner started while I work on lunch. Um, so yeah, everything's together so I can get a longer nap around lunch, and I just wake up when it's time to feed them dinner. Usually get them their baths and everything, and then they are off to bed after they've had dinner. Um, so yeah, it's not too bad. Maybe I'll show you all what my stores look like, because I still go to the store every day. I have kids. Kids need things. If you're a parent, you know that. A lot of the things I already have in my home, but for the most part, either I would want something, my husband would want something, my kids would want or need something. And both my husband and I work in healthcare, so we know how to keep ourselves safe. You wash your hands. Wash your hands. Keep a safe distance. But yeah, that is a couple minutes into my life currently in a nutshell, from coronavirus, and a little bit into my pregnancy, and a little bit into what I'm feeling um, or what I'm doing with my kids while they are taking this long break from school. Um, so if you are interested in what I fix for dinner, my quick meals that I fix for dinner, what educational programs or educationally things I do for my kids, um, what I shop for when I go to the store, being in a family of 6 and pregnant, um, or if I can do a regular night at work when I'm not screening for coronavirus. Comment below what you would like to see, and I will get that posted for you. Thanks for watching. Bye.